All right. Good afternoon and welcome to Senior Concerns Seminar Series. I am Hannah, the Care Manager here at Senior Concerns. If you are not familiar with our programs, I want to take a minute and share them with you. We have our Caregiver Resource Center with support groups. We have our Senior Advocate. We have an Adult Day program. We do Meals on Wheels for Thousand Oaks, Newbury Park, Westlake, Oak Park, and Agora. We do a geriatric in-home assessment program for a fee. And then we have pro bono legal and financial concerns. Today's seminar is Medicare Basics. And we are fortunate to have with us today George Lopez. He is a HICAP counselor, which stands for Health Insurance Counseling and Advocacy Program, HICAP with the Ventura County Area Agency on Aging. George has been a certified counselor with HICAP for 10 years. The purpose of HICAP is to provide free, unbiased counseling and community education on Medicare A, B, C, and D. HICAP completes comparisons on all products of C and D, retiree employer group versus Medicare, and HICAP resolves billing issues and helps apply for appeals. George is also a senior Medicare patrol counselor, a long-term care counselor, and a general community educator. And I will pass it over to George.
Well, thank you, Hannah. And I want to thank Senior Concerns for inviting us to this event today. Again, as Hannah said, my name is George Lopez. I've been with HICAP going on 10 years, and it's all volunteer work, and I really enjoy it. I enjoy getting out. And as Hannah said, we're going to be talking today. Let me share my screen with you so that you can see what I'm looking at, and you can see the material. Okay, and there's one other button here. All right, did it pop up? There we go. Okay, hopefully everybody can see that. So again, this is a Medicare Basics class. Hopefully all of you are going to be starting up with Medicare, or if you've already got Medicare, this will give you some highlights of Medicare and what your options are. Again, we're with Ventura County Area Agency on Aging. It's a direct service. And just so that you're aware, if you ever talk to your friends who aren't in California, let me open up something here. Okay, this little red dot here, hopefully you can see it. This ship right here, that's the State Health Insurance Assistance Program. Nationally, that's what we are, okay? Except in California, we're always a little different. We are HICAP, Health Insurance Counseling and Advocacy Program. So here's the next slide. So today we're going to be talking about, well, we're with the Ventura County Area Agency on Aging. And then the topics I'm going to be talking about are enrolling in Medicare, the different parts of Medicare, your options, for example, original Medicare versus Medicare Advantage plans, then Medicare supplemental plans insurance, which are commonly known as Medigap, prescription drug plans, and then a big thing that's coming up here starting in mid-October is the open enrollment period. So let's go to the next slide. Okay, on this slide, the Ventura County Area Agency on Aging, we serve older adults and persons with disabilities and their caregivers. There's a lot of different programs in VCAAA. And if you want to see all of them and see what they do, if you go to ventura.org's website and you go to services and select Area Agency on Aging, you'll see all the different types of services that are available. But at HICAP, we're primarily concerned with health insurance counseling, primarily Medicare counseling, but we also talk about the Benefits Enrollment Center, which provides assistance to low-income individuals, different types of programs. We counsel on that. And then also we talk about to veterans. And the reason we talk to veterans is there's numerous programs under the Veterans Administration. There's the VA health coverage, there's CHAMP VA, there's TRICARE. So there's several different programs, but they all work with Medicare differently. And VA specifically is a totally different program than Medicare. And then of course, we have the Senior Medicare Patrol. If you're talking about scams, ID theft, anything like that, if you contact HICAP and ask to speak with a Senior Medicare Patrol individual, we will gather your information, probably ask some additional questions, and move your concerns up, because Medicare fraud runs a little over $60 billion a year, and that's a continued thing, and it does make the news. So the next thing is the various departments. Again, as I said, VCAAA, which is Ventura County Area Agency on Aging, different programs, fall prevention, nutrition, transportation, etc. So a lot of different programs available through VCAAA. The next slide here is, now we're going to be talking about Medicare. So for most individuals, okay, most start Medicare at 65 or older. That's the bulk of individuals in Medicare. But there are individuals that qualify for Medicare prior to the age of 65, and that's if they have a disability. And that disability is defined by the Social Security Administration. If you qualify under the Social Security Administration guidelines, then you can qualify for Social Security disability prior to age 65. And you can see on the slide, there's several different things that qualify individuals for Medicare prior to 65. Now, one of the booklets that is sent out to everyone that's in Medicare is this Medicare and You. And this is the 2023 booklet. It just came out. There's about 125 pages in the booklet. Covers a lot of different topics in Medicare. And if you're in Medicare already, you will be getting it soon. And if you start with Medicare, you will also get this booklet. Okay, next slide. Okay, agencies responsible for Medicare. These are the four main agencies that you have to deal with if you qualify for Medicare. The primary one is Social Security Administration. To sign up for Medicare, you have to go to the Social Security Administration or the Railroad Retirement Board if you're a retiree from the railroad, okay? We don't see too many of those now, but most of the people I refer them over to the Social Security Administration, and we'll talk a little bit more about that here. Then there's the OPM, Office of Personnel Management. Primarily federal retirees will deal with the OPM. And then the agency that oversees Medicare, the whole program, is CMS, the Centers for Medicare and Medicaid Services. They administer the whole program, the benefits, the payments, everything. So they are the main agency that we deal with. Okay, this slide I put in here just to give you an overview of how large Medicare is. Medicare enrollment for 2022, you can see it was a little bit over 64 million individuals, and 34 million plus are in original Medicare, and almost 30 million are in Medicare Advantage plans. So the combination of those two gives you the 64 million. Now, down here on this little slide, I've kind of broken out 2019, 2020, and 21. You can see the growth of Medicare there, okay? And the reason for that is every day, there's approximately 10 million people per day are turning 65. That has continued to happen up until about 2030, okay? So this program will continue to grow. And then in the highlighted items, age and disabled, most people are in the age program, meaning 65 and over. But the disabled, that is individuals that are younger than 65. Okay, so you have decisions to make. If you're gonna qualify for Medicare and you're gonna start the program, you have several decisions to make. Most people make that when they're turning 65. But some people work past 65, have employer health coverage, and consequently, they don't enroll in Medicare. And so long as their employer coverage is credible coverage, they don't have to enroll in Medicare. They can do it when they retire. So that's why we say 65 or retire. And then the question is, what am I going to enroll in? There are essentially 5 parts in Medicare. So you have Part A, Part B, you have Part C, which are Medicare Advantage plans. You have Part D, which are standalone prescription drug plans. And then the other options are, if you're in what we call original Medicare, there's Medicare supplemental insurance, commonly known as Medigap. So those are the primary programs you're looking at when you enroll in Medicare. Now, some of you will still have employer health coverage. If you have an employer coverage and it's credible coverage, you don't have to enroll in Medicare. Okay, you'll have what we call a special enrollment period to enroll in Medicare when you retire. Now, retiree coverage is not employer coverage. So if you have retiree coverage and you're turning 65, you need to enroll in Medicare. And if you don't, and you do it later on, penalties may apply, okay? So retiree coverage is not considered employer credible coverage. And then some individuals have COBRA. COBRA, again, is not considered employer health coverage. It's not credible. So as a general rule, you're going to have to enroll in Medicare. But that's a general rule, okay? So let's go to the next slide. Okay, this slide here talks about when you can sign up. When do you sign up for Medicare? So for individuals that don't have Medicare, and this is individuals generally turning 65, they will enroll during their initial enrollment period. Okay, so that initial enrollment period is 7 months. So it's 3 months before your 65th birthday, then it's the month of your 65th birthday, and it's 3 months after. So that's a 7-month period you have to enroll in Medicare. Okay, so that's when most people enroll. Then you have the special enrollment period. That's for individuals that work past 65, have credible employer health coverage, so they don't enroll in Medicare. So when they retire, they will use their SEP to enroll in Medicare without any penalties. And then there's the general enrollment period. The general enrollment period is for individuals who have missed their initial enrollment period and or their SEP. So now they've missed enrollment, then they will enroll during their general enrollment period. The general enrollment period is January through March. And currently, if you enroll in the general enrollment period, your Medicare will not be effective until July of that year. That rule will change starting January 1 of 2023. What happened then is if you enroll during the general enrollment period, your Medicare will be effective the month after your enrollment. Okay, so you won't have to wait until July. Now you'll notice down here, I'm highlighting the penalties. If you enroll in enroll after your IEP, initial enrollment period, or your SEP, you may have a late enrollment penalty for Part B or Part D or both. Okay, and unfortunately, that Part B and D penalty, those penalties last forever. You'll be hit with that penalty every month, so long as you have Medicare. Okay, now we're jumping over to the right side here. So we're over here. If you already have Medicare and you want to change what you're enrolled in, there's various periods you can do that. So the first one, and we'll talk a little bit more about that, is during the open enrollment period. That's the annual open enrollment period. That is October 15th through December 7th. You can change your Part C Medicare Advantage plan or your Part D PDP plan, okay? You can, and if you do change it during the open enrollment period, it will be effective the first day of the new year. And then there's what we call the Medicare Advantage open enrollment period. That's for individuals that have a Part C Medicare Advantage plan. They can change their plan January through March of the new year. And then there's what we call a 5-star enrollment period. That's for individuals that have, as a general rule, have either an MA plan, Medicare Advantage plan, and it's a 5-star plan, and they don't have a 5-star plan and they want to enroll in a different plan. The only plan they can enroll in during that period, and that period is December 8th through November 30th, they can enroll in a 5-star plan. There are 2 5-star MA plans, Medicare Advantage plans in Ventura County. And I'll talk a little bit more about that later. And then there's other special enrollment periods. Again, it just depends on your situation. There's various enrollment periods. And again, if you have a special situation, I would recommend that you make an appointment with HICAP and we'll go over your specific circumstance. All right, let's go to the next slide. All right, so for a fair amount of individuals, Medicare enrollment is automatic. So if you're receiving Social Security benefits or railroad retirement benefits prior to 65, so if you enroll in Social Security early, at least 4 months before your 65th birthday, you will automatically get a welcome to Medicare, get ready for Medicare package. And that will be mailed to you 3 months before your 65th birthday. For individuals that are on Social Security disability and they've been on Social Security disability for 24 months, starting on the 25th month, they will qualify for Medicare and they will also get a welcome to Medicare. And that welcome will include their Medicare card. And I'll show that to you in a minute here. So let's go to the next slide. Now, for those of you who aren't collecting Social Security benefits or railroad retirement benefits prior to your 65th birthday, then you need to contact the appropriate agency. For most of you, that's going to be the Social Security Administration. And again, it's recommended you contact them 3 months before your birthday, or if you worked past 65, but you had employer health coverage and you're retiring, then again, you want to contact the Social Security Administration to enroll in Medicare. It's up to you to enroll in Medicare. And unfortunately, I've dealt with a few people that have missed their enrollment period and then penalties apply. So that's, again, it's up to you if you're not collecting Social Security or retirement benefits, railroad retirement benefits. Next slide here. All right, so on this slide, this is your Medicare card there, that red, white, and blue card. It is the size roughly of a credit card. It's paper, okay? So, and it has your name on it. And again, it's just you because each individual has to apply for Medicare. And then you'll have a Medicare unique number, okay? It's an 11-digit number. That will be your Medicare number as a general rule for the rest of your life, okay? It's a unique number. That number used to be your Social Security number, but there was so much fraud with that. So they finally changed it so it's a unique number. It's not your Social Security number. And then what this card reflects is your Part A and Part B, hospital and medical coverage. This is your government portion of your Medicare, okay? This is the only government portion of Medicare. And what it does is it reflects the effective date here of your enrollment. It's always as a general rule, if you enroll when you turn 65, it's your birth month, the first day of your birth month that you turn 65. If you enroll later, then that later date is going to be reflected there, okay? So if you decide to keep Medicare, you'll use this card, you'll take it to doctors, your new doctors, you'll take it to any facilities you go to. But if you're still working past 65 and you again have employer health coverage that's credible coverage, you don't have to enroll in Medicare. So what a lot of people do is they will refuse this Part B, and we'll talk about that here in a minute. Well, you can refuse it. You have to return the whole card back. It's attached to a sheet that you return back. You decline B, but what happens is A is automatic. For most people, so long as you've worked 40 quarters or approximately 10 years, your Part A of Medicare is free. There's no monthly premium. So you will stay enrolled in that. So Medicare will send you a new card with just the hospital Part A reflected, okay? And then later on, when you retire and apply for Part B, you will get a new card, okay? So that's the Medicare. Okay, and then here's Medicare coverage. And this slide's very important, okay? There's two ways to get Medicare, okay? You either are in option one, you're either an original Medicare. If you're an original Medicare, you'll have Part A, Part B. You have the option to enroll in Part D for drug coverage. Those are standalone plans. And also you have the option to enroll in a Medicare supplement plan, commonly known as Medigap. And Medigap, there are plans. And I'll talk about a little bit more about that, but those are your options under original Medicare. The benefit of being an original Medicare is you can go to any doctor, any facility nationwide, so long as they accept Medicare. So you have a lot of options there, but you're making the decision of what doctors you want to see, what facilities you want to go to, etc. That's original Medicare, okay? Then your second option are Medicare Advantage plans. Okay, Medicare Advantage plans, what happens there is Medicare transfers its responsibility for your health coverage to this Part C. So it's Part C Medicare Advantage plan you enroll in. Okay, so you're no longer in original Medicare, you're in a Medicare Advantage plan. And the thing about that is then you're in a network, and I'll talk a little bit more about that, but you're in a plan network. You must stay within that plan network. You don't have the option to go to any doctor, any facility you want. And these are mutually exclusive. You either go to original Medicare or you go to Medicare Advantage. Okay, in this state, in this county, if you start with original Medicare, you can always go to a Medicare Advantage plan down the line a couple years later if you want. And if you start out with a Medicare Advantage plan and then decide you want to go to original Medicare, you can always apply at that time for a Medicare Advantage plan. But at that time, the plan can do underwriting and they can deny you coverage. So you only have a guaranteed right to enroll in a Medigap plan during your initial enrollment in Medicare. So that's original Medicare, and I'll talk a little bit more about that. So let's go to the next slide. Okay, so this is Medicare Parts A and B. So under Part A here, it's inpatient, okay? So it's medically necessary hospital stays, skilled nursing, hospice, home health care, etc. It must be inpatient. That's Part A. Now, Part A, again, as I indicated, excuse me, so long as you've worked 40 quarters, again, approximately 10 years, your Part A will be free. But then you have these deductibles and copays. So if all you had was Part A and Part B, all these deductibles and copays will apply, okay? So under Part A, you have a deductible of $1,556. That deductible can happen multiple times in a year. What happens is if you go in the hospital, you would be responsible for that deductible. When you're discharged, If you go back in the hospital later on in the year, if there's more than a 60-day break between your discharge date and the date you go back in, that starts a new deductible. They call it a stay of care here, okay? And then you have these different copays. The copays apply during these periods. So the first copay is days 1 through 60 at 0, but days 61 through 90, the copay is $389 per day. Days 91 plus. The reason it's plus, there's a bundle of 60 days that you can use. And once you've used them, that's it. So days 91 through 150, your copay would be $778 per day. And anything after that, you would have to pay all the cost. As I indicated, I've been doing this for almost 10 years now. I've run into one client that ran into this problem. Most people, if they go into the hospital and they need to recover, they'll go to a skilled nursing facility. So they're out of the hospital, so they don't have to pay all these copays. But this individual could not be moved out of the hospital. He had to stay. So he ran into that issue. And then you also have to pay generally for the first 3 pints of blood. And then if you go to a skilled nursing facility, Medicare will cover the first 20 days, so long as you've been in the hospital for a 3 overnight stay. You've been admitted to the hospital. You're not there for observation. Some people are in the hospital for 3 nights, but they're there for observation. So you need to confirm that you've been admitted into the hospital for a 3 overnight stay. Then you will not have to pay. Medicare will cover the first 20 days. But after those 20 days, days 21 through 100, it's $194.50 per day. So that's Part A deductibles and copay. And then you have over here, you have Part B, outpatient. So your doctor visits, ambulance, durable medical equipment, etc. Most people pay a monthly premium right now of $170.10. If you're collecting Social Security will automatically withhold your payment. But let's say you're not collecting Social Security yet, but you're enrolled in Medicare, then you will have to send in this monthly payment of $170.10. And then there's a deductible under Part B. But this deductible is an annual deductible. This year, that deductible is $233. So long as you've met your deductible and you're current on your monthly payments, Part B of Medicare will cover 80% of your cost, and you'll have a copay of 20%. Like everything else, there's always exceptions. You see this excess here. If a doctor does not fully participate in Medicare, they're allowed to charge an additional 15% above the Medicare charge. I've never seen this charge on a billing, and only about 4% of the doctors fall under this category. Now you have to remember, some doctors don't accept Medicare at all. So if you go to a doctor that doesn't accept Medicare at all, you'd have to pay all the costs. So it's very important to ask your doctors, do they accept Medicare and do they accept it in full? Okay, and then penalties. We've briefly talked about penalties. If you don't enroll in Medicare timely and you're qualified for it and you don't have employer credible health coverage, then penalties will kick in. Now, as far as premiums, there are situations where individuals have higher monthly premiums. If you're single, and your income on your tax return, you look at your adjusted gross income, and there's some adjustments you have to make. So it's called modified adjusted gross income. If it's more than $91,000, your premiums will be higher. If you're a couple and your modified adjusted gross income is more than $182,000, you're going to pay a higher premium. So, and that higher premium applies to Part D for the drug plans and Part B, okay? So let's move on. All right, I wanted to highlight this because this always is something that people don't know. Okay, what doesn't Medicare? These are some of the things that Medicare Part A and Part B will not cover. Okay, and you can see what those things are. Three of the most important things that people always ask about are dental care, vision coverage, and hearing aids. Currently, those items are not covered under Part A or Part B of Medicare. Okay, there's discussions going on about it, but right now it does not cover it. These, and then there's some other things that you can see here that are not covered. One of the other things that surprises people is long-term care here. Long-term care is not covered by Medicare as a general rule. Okay, now you'll see the note down here. You may have some coverage under a Medicare Advantage plan, your Part C plan, or if you have Medicaid, which is in California, Medi-Cal, okay? So, but what I can tell you about Medicare Advantage coverage, they do cover, most plans in this county cover dental and vision and hearing, but it's very basic coverage. If you want better coverage, they will upsell you a plan, okay? All right, now we're talking about the specific things I was talking about, okay? You had the option 1, which is original Medicare or fee for service. And then there's option 2, which is Medicare Advantage. This is option 1. Option 1, you're in original Medicare or fee for service. So you have parts A and B of Medicare. If you want drug coverage, you enroll in a Part D PDP plan, prescription drug plan. Those are standalone plans, and we'll talk a little bit more about those. And then to cover these Part A and Part B deductibles and copays, people will enroll in a supplemental coverage plan, commonly known as Medigap. There are plans, and I'll go into that here next, okay? So, Medigap policies. Medigap policies are sold by private insurance companies, okay? And what they do is, it's gap coverage. They're covering those Part A and Part B deductibles and copays. So that's what Medigap does, and I'll show you those plans in a second. And then, as I indicated, these private insurance companies, there's a lot of them, but the Medigap plans themselves are standardized coverage. So there's plans A through N. So like an A plan only covers the first, you'll see on a list I'm going to bring up here, covers 4 items. No matter what insurance company you buy your coverage through, it's standardized. They must cover the same thing. If it's an A plan, they have to cover what's an A. So you'll see those here. But the cost of the plan is different. It depends on what company you go to, okay? So again, it really depends on the company you're enrolling in. And just, I want to highlight one more time. If you're an original Medicare, when you first start Medicare, so you're turning 65, you're enrolling in Medicare, and you go with option 1, original Medicare fee for service, and you enroll in a Medigap plan. At that point, these insurance companies cannot do any underwriting. They must sell you a plan at the least cost given your age, okay? So you have a right, no questions asked, to enroll in a Medigap plan during your IEP, and initial enrollment period, or your SEP, special enrollment period, okay? So here's how Medigap plans work. Here are the benefits that, under this benefits here, this is what's being covered. These are all those Part A and Part B deductible amounts, except this foreign travel. Foreign travel is not covered by Medicare, okay? But in Medigap, they add foreign travel, okay? And you can see there you have plans A through N here. So the plan that covered the most was the F plan. The F plan covered everything, okay? But there's a note down here. It says, Plan C and F won't be available to people who were newly eligible for Medicare after January 1st, 2020. So if you turn 65 after January 1st, 2020, you cannot enroll in an F or C plan, okay? And you'll notice the F and C plans cover the Part B deductible. They were the only two, but they changed the law, okay? So you can no longer enroll in those. So the plan that covers the most is the G plan. G covers everything except that Part B deductible, and that Part B deductible is $233 this year. So that's how Medigap plans work. So you have A, B, D for drugs, and Medigap, and depending on which Medigap plan you enroll in, will determine what your cost to be. So obviously the G plan is going to cost more than the A plan. One of the questions I get is, well, I'm new to Medicare, I'm 65, I have no health questions. Can I enroll in an A plan? And then 10 years down the line, when I start having health problems, can I enroll in a G plan? And the answer to that is, the law says no. If the plan lets you, you could, but the rule is the plan does not have to let you. So we always recommend you enroll in the plan that covers the most. You can always go down, but as a general rule, you can't go up. So that's Medigap plan coverage. All right, now we're looking at D coverage, Part D, which are standalone drug plans, okay? Well, not standalone, we'll talk about it. Part D is optional, okay? Again, you don't have to enroll in it, but if you're qualified for it, and if you don't have a credible drug plan through another source, then there's going to be penalties that apply, okay? So if you enroll in a D plan. So again, these are private insurance companies. If you have original Medicare, remember that was option 1. These are PDPs, standalone drug plans. In Ventura County, there are 10 providers that offer 25 different plans, okay? And those plans run, the least expensive plan is $7.50 a month. And that's what I recommend people enroll in, even if they're not taking drugs, so they have no penalty. And the most expensive plan is $160 plus. So cost varies, okay? So it really depends on what you enroll in. And then the Medicare Advantage plans, the Part C plans, there are 23 different plans. Of those 23 plans, 20 of them are a combination of health coverage plus drug coverage. So everything's built in, okay? And then there's some other Medicare health plans. As a general rule, most of you are just going to be an original Medicare fee-for-service or Medicare Advantage. Okay, let's go to the next page, Part D. Again, this highlights, it's optional, but you can see over here in this yellow thing, if you join late, you're going to have a lifetime penalty. It's going to be assessed each month for the rest of your life that you're enrolled in Medicare Part D. Now, the D plans have formularies. They have the different drugs in their formularies. You can see the requirements that they have, okay? And if they make any changes, they must notify you. Now, one of the things is, if you use a preferred pharmacy here, generally your out-of-pocket cost is going to be less than a standard policy. So you want to be careful there. And then the last item, low-income individuals do get assistance. Social Security provides a plan called Extra Help or low-income subsidy that individuals can enroll in, and their drug costs will be less. And then finally in Part D, so in Part D, you have a monthly premium. Most plans have a deductible. This year in 22, the highest deductible is $480. In 2023, that is, if I'm correct, it's going to $505. And then you have co-pays and co-insurance. And then you have out-of-pocket costs, depending on the categories you're in, your cost varies, okay? This is going to change. There was a recent change in the law. The Inflation Adjustment Act, I think is what it's called. It will change this starting in 2023, but it's going to take several years for your cost to get reduced. So there will be more about that. You'll see that in the news later on. Okay, so then now we're talking about Medicare Advantage plans. Medicare Advantage plans, as I indicated previously, that's the second option. Okay, remember you have original Medicare or fee-for-service is option 1. These are Part C Medicare Advantage plans. Medicare Advantage plans in Ventura County, I mentioned there were 23 different plans. 22 of those plans are HMOs, Health Maintenance Organizations. So typical HMO, you select a primary care physician. If you want to see a specialist, you still have to go to your primary and they will do a referral. You must, and they have plan networks. You must stay within the plan networks. If you go outside of the plan networks, you will have to pay all the costs. And all these companies are private companies, okay? And again, most of them, 20 of the plans have Part D drug coverage built right into the plans. And then here again, here's some highlights of Medicare Advantage plans. The biggest difference between original Medicare or fee-for-service or Medicare Advantage plans is this fourth item here. You have other extra benefits in Medicare Advantage plans. Generally, you have vision coverage, dental coverage. A lot of them have wellness benefits. Some of you may have heard of silver sneakers. They have those benefits. So that's also available. Okay, I talked about the open enrollment period. During the annual open enrollment period, which starts October 15th and runs through November 7th, you can change your Part D plan or Part C plan. Part C is Medicare Advantage. If during that period you would select a new plan, it would be effective January 1 of the new year, okay? So that's the open enrollment period. At HICAP, we help assist people make changes. So if you make an appointment with HICAP during the open enrollment period, we will run the way you know which drug plan is the best is on Medicare.gov. There's an item called Plan Finder. And in that Plan Finder, you input your medications, the dosage, how frequently you use it, and the name of it. You input all your drugs. You run a comparison, and that Plan Finder listed in order of least expensive plan to most expensive plan that covers your drugs. And we'll let you know what that is, and you can use that to change your Part D plan or Part C plan. And we caution people, these plans change. They change their formularies, they change the cost of their drugs. You don't want to, just because you like your current plan, you want to make sure that's still your best plan for the new year. Because we've run into people who don't make any change. The new year they go to and their plan changed and they have higher costs. And just to give you an example, last year, 2021, we had 32 plans. In 2022, we have 25 plans. So we lost several plans and things got consolidated and some plan costs went up. Okay, so you want to be careful with that. Okay, here's some options for individuals with limited income or resources. There's the Medicare Savings Program, and these are all based on income. There's 3 different programs under the Medicare Savings Programs. There's the Extra Help Program that I talked about. That's through Social Security. It's also called Low Income Subsidy. That reduces your drug cost. There's what is nationally known as Medicaid. In California, it's called Medi-Cal. You can enroll in Medi-Cal, and then there's other programs available. And then here's just some links that you can go to get additional information. Medicare's website is an excellent website. It gives you a lot of good information. And then, of course, you have these other websites that I briefly touched on. I didn't touch on Covered California. Just some people I talked to before they turn 65 have Covered California. It's the marketplace. If you have Covered California, you cannot continue it past 65 if you qualify for Medicare, okay? So, all right. So that's the presentation. Again, I recommend that you schedule an appointment with HICAP so we can sit down with you. And if you have any specific questions, we can address those questions. And you can make as many appointments as you want. You see our contact phone number there and our email address. So, all right, so that's my presentation. I'll stop sharing this slide. And if we have any questions, I will try to answer them.
All right. Well, thank you so much. That was a wealth of information. We really appreciate it. I did get a few questions about if the recording or the slides will be available, because it is a lot of information. So the recording of this seminar will be on Senior Concerns website. And then George was kind enough to give us the slides. So the slides from this presentation will be emailed to everybody either tomorrow or Monday. We'll email them out.
Thank you, Anna.
Yes, and thank you. And we'll start with the first question. The application for benefits form on the SSI website asks for employment start date and end dates for the current employer who provides your health insurance. Why is that needed? And how do those factors, or how do those dates factors into getting Medicare?
I'm assuming if you're applying for Medicare, and if you work past 65, there's two forms you have to fill out. There's a form 40 something, and then there's a form, I forget, it's like a 256 or 536. That form that your employer has to give the dates you've worked for them. And the reason they're doing that is you've worked past 65. In order to not have any penalties apply, you have to prove that you had credible employer coverage. So long as you had credible employer coverage, penalties will not apply. But that's why your employer has to fill out that information.
All right, thank you. And our next question is, when in the process of signing up for Medicare, when can someone enroll in Part D coverage? Does that need to be after enrolling in Parts A and B?
Okay. You must at a minimum have Part A or Part B to enroll in Part D. So you have to have one of them.
All right. And then I guess that same question is, and it sounds, does this apply to enrolling in Medigap insurance plan?
Okay, to enroll in Medicare Advantage Part C, which would be that option 2, or to enroll in Medigap, which is original Medicare fee-for-service, you must have Parts A and Parts B.
Perfect. And next question. Does Medigap plan, or do Medigap plans usually provide more coverage than Medicare Advantage plans?
Well, there could be an argument made. Medigap, okay, is going to cover all of those Part A and Part B. Well, it covers those Part A and Part B deductibles and copay, depending on which plan you enroll in. If you enroll in the G plan, which covers the most, almost everything's going to be covered under that, okay? But you don't get dental, you don't get vision, you don't get hearing, you don't get those things. So you'll have to pick up that type of coverage separately outside of Medicare. If you're in a Medicare Advantage plan, Medicare Advantage plans cover dental, vision, hearing at a basic level, but they do cover it, and they cover other things that original Medicare fee-for-services do not cover. The big difference between the two plans is there's two things. Number one, original Medicare fee-for-service Medigap, you can go to any doctor, any facility nationwide. So you have a lot of flexibility, but you have to manage your own care, okay? And the cost of Medigap plans is going to be more than if you enroll in a Medicare Advantage plan. Medicare Advantage plans of the 23 plans, only 2 of the plans have monthly premiums. Where they get their cost is they have deductibles and co-pays. So you have to look at each plan to decide how much it's going to cost you, because you're not going to have the Part A, Part B deductibles and co-pays. You have to look at each plan. Very similar plan-wise, but you have to look at the plans. So again, lower cost, but then you must stay in their networks. So you're tied to the network. So if I've run into a couple of people that had special health issues that wanted to go to a doctor outside their network. The plan wouldn't let them. So they come to us and they say, can we enroll in Medigap? You can always apply to Medigap at that time. But at that point, as a general rule, if you're not within your first year of your Medicare Advantage plan, as a general rule, Medicare Advantage plans can do underwriting at that point. They can ask you healthcare questions and they can deny you coverage, okay? But don't get discouraged. I would apply if you want to go that way. Just understand is generally if you want a Medigap plan and you want it guaranteed you're going to get it, you have to do it during either your initial enrollment period or your SEP.
Great, thank you. Next question, I am self-employed and intend to keep working past 65. Are there any other stipulations in regards to Medicare?
I'm not sure what stipulate, if you're working, number one, if you're going to keep your health coverage, the question is, does that health coverage qualify as employer health coverage? Some people are self-employed, their coverage doesn't qualify as a Medicare credible coverage. So you need to contact your insurance company. Otherwise, if you're self-employed and you're just going to go to Medicare, then it's normal Medicare. You make the decision, option 1 or option 2.
All right, and if you have original Medicare option 1 and did not opt in for Part D drugs, can you do this later? And is there a fee?
Yes, number one, Part D plans always have premiums, but if you're eligible for Medicare, including Part D, if you don't enroll in it when you're first eligible, and I run into this all the time, I run into people who are taking no medications, so they don't really want to enroll in Medicare. You don't have to enroll in Part D. You don't have to enroll in D. You can enroll in it later on. But if you enroll in it later on, there's a Part D penalty. That penalty is 1% per month of the national average. The national average cost is about $35. So your monthly, each month you're adding approximately 35 cents to your penalty. So the longer you go without coverage, that penalty is going to grow. So let's say you have a $7 penalty. Well, that $7 penalty will be added each month for the rest of your life, so long as you have a Part D plan. Right. So yes, you don't have to, but there's a cost. Now, some individuals out there are veterans. If you're a veteran, you're not a retiree, you're a veteran, the VA drug coverage is considered credible. So if you qualify for it, then later enroll in a D plan, you will not have a penalty, okay? But VA health coverage is not considered credible. So you would have a Part B penalty if you don't enroll when you're eligible.
All right, and the next one says, please confirm I can apply when I turn 65, even if I'm still working.
Yes.
And, okay, you said yes?
If you're still working and let's say you have employer coverage, but you want to drop it, you can do that and you can enroll in Medicare.
All right, and then the next question from the same person is, just to confirm, I should look at applying 3 months before my birthday.
That's the general rule. You apply 3 months before. So if you apply in month 1, 2, or 3, your coverage will be effective the first day of your birth month, okay? If you apply later, like your birth month, it'd be the next month. And then if you apply the 5th, 6th, or 7th month, it starts later. So yes, it's best to always do it early. So if you run into any issues, you'll have time.
Perfect. And this might be a more specific question, but I want to ask it. I have a retiree health, wellness, vision, eye, and dental care coverage. Do I need to get a Medicare Advantage plan in addition to Medicare? Right now, I have Medicare and retiree insurance.
Let's talk about retiree insurance. If you have retiree health insurance, it's not considered credible coverage. So you must enroll in Medicare. If you don't, you're going to have penalties. Now, first thing I tell people is talk to your benefits coordinator. Some plans, if you're in a retiree health plan, require you to enroll in Medicare. For example, TRICARE. TRICARE is the military, people who retire from the military. If they have TRICARE and they turn 65 and qualify for Medicare, they must enroll in Medicare. Medi-Cal beneficiaries, if they qualify for Medicare, when they qualify for Medicare and they turn 65, they must enroll in Medicare. So you need to go to your benefits coordinator and say, what are my requirements? I'm turning 65. Do I have to enroll in Medicare? The only plans I know that don't require you to is if you're a federal retiree and you're in the federal retiree health benefits program. Right now, that plan does not require you to enroll in Medicare. But again, the cautionary tale, if you don't enroll and then you have to and you decide to later on, there will be penalties in Part A and Part B.
All right, and our last question, when you say Medigap plans, are you meaning such supplemental insurances as Secure Horizons, Kaiser, etc.?
Well, no, as a general rule. Okay, Kaiser does not have a supplemental plan. They don't sell supplemental plans, okay? So when I talk about Medigap, it's Medicare supplement plans. If you go onto Medicare's website and you do a search for Medicare Medigap, it'll give you a breakdown of all the companies. The problem with that is a lot of companies sell Medigap plans, plus they sell Medicare Advantage plans, MA plans. Kaiser for sure does not sell a Medigap plan. Kaiser is managed care. They sell MA plans. So hopefully that answers it.
Perfect. And it looks like we have one more minute, but one just came in. So let me see if we have time to answer it. What constitutes a credible employer coverage? If you're not employed and you're on your partner's employee medical coverage, is it credible coverage?
All right. If you're on your partner's, if on your spouse's health coverage, that's credible coverage. That's employer coverage. Okay. So we see that all the time where one spouse working or one retired and they're on their spouse's plan that's still working, then you're going to have a special enrollment period.
All right. And I have a few thank yous in the chat box.
Thank you everybody for attending. And if any of you have any questions or would like another presentation on any aspect of Medicare, just let Hannah know or send us an email. Yes. And thank you for your time. I appreciate it. And thanks, Hannah.
All right. Thank you, George. Thank you for all the information today. And please reach out, as George said, to me, and we can get your questions answered if anything else comes up. And thank you so much, George.
Thank you, Hannah. Have a good day, everybody. Bye-bye.
Yes, have a good day.